It's time to announce this week's Southern Tier Tuesdays winner. Congratulations to the Addiction Center of Broome County and its Health Home program. For more than 40 years, the Addiction Center of Broome County has assisted individuals with substance use disorders and their families. The nonprofit is being awarded $2,000 from Upstate Shredding and Adam and Clover Weitzman. With me this morning is the Director of Care Management Services and the Health Home Supervisor to tell us more about this program. Well, thank you so much for joining me this morning, and congratulations.
Thank you.
So first, why don't you tell us a little bit about what you do with this Health Home program?
So what we do is we connect people to services that are in the community that they might have not known that were available to them in the past. We work with the hospitals in the area. We work with doctors' offices, with the Broome County Department of Social Services, in a partnership to kind of help and assist those clients. Even though we do focus on substance use disorder and mental health, we are not limited to helping that population. We are able to help anybody really that needs the assistance, as long as they qualify for the program.
Okay, well, so speaking of the qualifications then, what are the requirements to get this help?
Sure, so the main requirement is having to have Medicaid. The whole point of the program was to keep people out of overusing the ER. So really what our care management will do is connect them to primary care or follow up, make sure they're going to appointments. So Medicaid is the #1 factor. Second is mental health diagnosis or substance use diagnosis. There's also a few physical health as well. They have to be chronic conditions. They can sign up on online, referrals are online, and we also have an enrollment specialist as well. So.
Okay, so how do people get enrolled with this then?
So we have, like she was stating, we have an enrollment specialist. His name is Mark, and he's absolutely incredible.
We love Mark.
Mark is great. And what they would do is there is a website that they can go to, which is Honey, spelled HHUNY.org, to make a referral. Probably one of the easiest referrals any provider or person will ever have to do. And it can be a self-referral or community referral. You just fill out basic information. The referral then goes up to our Rochester office, and they send it back down to me. And we do outreach with the referred party and make sure that they get connected to all the services that they need.
Okay, so it sounds like the best way to sort of start this process is to do it online.
Do it online, but also they can call the office directly and ask for myself or Mark, and we will get them connected. Sometimes we can get them connected right away. Not necessarily connected to, obviously, the primary care provider or the dental provider, but at least connected with a care manager who can begin to assist them immediately.
And now, once people are enrolled in the program, what do they get help with?
We always say there's nothing we don't help with, because there's really not. The main things, like I was explaining before, is medical care. So we really want to make sure that they're connected. We want to make sure they understand what their treatment plans are. So we'll go to appointments with them, and we'll sit there with them, and we'll make sure that the client understands like what's going on and what's happening with them, because I don't know about you, but it can be confusing sometimes. So that's the main thing. We help the best we can with housing. We help the best we can with transportation. There's really nothing that we don't help them with. We try our best to cover all the bases.
Right, yeah. And so it sounds like a grant like this would make a big impact, or it would be very helpful for this.
Absolutely. I think with a grant like this, we can assist people in the community to get toiletries that they might not have had, or personal care needs items. It can assist with just so many different, like a wide array of items that they may not have had before. Again, I think toiletries is the biggest thing with the cost of the pandemic and what it's done with inflation. Things are very expensive right now. And so assisting clients to get, I mean, toilet paper and toothpaste and toothbrushes, stuff for hygiene, deodorant, stuff that maybe, you know, wouldn't necessarily be an issue for someone is definitely an issue for this population.
Yeah. And so we've been talking specifically about the Health Home program, but that's not all that the Addiction Center does.
Absolutely. So the Addiction Center of Broome County started, like you stated, 40 years ago, and was an outpatient clinic for substance use disorders. We now have 3 separate locations, one in Norwich, one in Endicott, and one in Binghamton. The Endicott location focuses on trauma, and they have a family navigation program. They work with youth, we work with adults. We have a needle exchange program, the syringe exchange program. We have, you know, medical staff on board who do the medication-assisted treatment. Of course, the outpatient clinic still. We have the health home, and we have the peers program that, I mean, the peers, again, go above and beyond, just like the care managers. I couldn't be more proud to work for an agency like ACBC that provides and just collaborates together to make sure that we're looking at the whole person and treating every aspect of their life. And if we can't do it, we'll find somebody who can.
Yes, all right. Well, sounds like it's a great initiative. Thank you so much for joining me this morning. I really appreciate it.
Well,
Thanks
thank
for
you,
having
and thank you again for this opportunity.
All right, for more on previous grant recipients, be sure to check out Southern Tier Tuesdays on Facebook, Instagram, and Twitter, and head to southerntiertuesdays.com to nominate your favorite nonprofit for a chance to win $2,000. Nominations for April end today at noon.